The purpose of this presentation is to inform listeners of the medical, surgical, and radiological treatment options for patients with head and neck cancer. As a result of this presentation, learners will be able to differentiate medical, surgical, and radiological treatment strategies for head and neck cancers. Learners will also be able to summarize treatment options for head and neck cancer. Cancers of the Head and Neck by Elizabeth Bertram. To start, it is important to define head and neck cancers. Head and neck cancers include cancerous tumors that are above the thoracic inlet and below the level of the skull base. More specifically, it encompasses malignancies arising from mucosal surfaces of the oral cavity, pharynx, larynx, and paranasal sinuses, as well as cancers originating from major and minor salivary glands. Head and neck cancers have a variety of causes. The main risk factor is smoking tobacco. It is the dominant cause of head and neck cancers, and it is highly correlated with oral cavity, pharyngeal, and laryngeal cancers. Using cigars and pipes, smokeless tobacco, which is also known as chew, marijuana, alcohol, vaping, HPV, and poor oral hygiene are also risk factors. The three treatments for head and neck cancer are chemotherapy, surgery, and radiation. Chemotherapy is a drug treatment that uses powerful chemicals to kill fast-growing cells in your body. Surgery removes the cancerous tumor and some of the surrounding tissue. Removing healthy tissue surrounding the tumor is called surgical margins, and it is used to minimize the chance of reoccurrence. Radiation uses high-powered energy beams, such as X-rays or protons, to kill cancer cells. This therapy can be distributed externally through a large machine, or a smaller device may be placed inside of the patient to distribute radiation therapy. Patients undergoing treatment for head and neck cancer experience a variety of side effects. Chemotherapy short-term side effects include nausea, vomiting, hair loss, and fatigue. The long-term side effects of chemotherapy include damage to tissues, nerve damage, and a risk of reoccurrence. The side effects of surgery vary depending on where the tumor was removed. Common side effects of surgery in head and neck cancer patients include speech, mastication, otherwise known as chewing, and swallowing impairments. Radiology side effects include dry mouth, difficulty swallowing, thickened saliva, tooth decay, and nausea. I have looked into 3 research articles, each one pertaining to one of the treatment options available for patients with head and neck cancer. All 3 articles provide the outcomes of the subjects. The article related to chemotherapy was a 10-subject study that used intra-arterial chemotherapy. The researchers aimed to determine if a hook-type microcatheter or a steerable microcatheter is more effective at distributing chemotherapy into one artery at a time. They found that the steerable microcatheter is more effective due to its ease of use for the oncologist. The image below shows the hook-type microcatheter dispensing chemotherapy into the facial artery, then the lingual artery. The next article was a literature review that aimed to find the most effective surgical methods for removing oral cancer. They found that incorporating surgical margins into all tumor removals had a great impact on overall survival. The 5-year overall survival rate increased from 21% to 72%, and the 10-year overall survival rate increased from 0% to 64% when surgical margins were used. The final article was a 26-subject study that looked at the use of radiation for head and neck squamous cell carcinoma. A major side effect of radiation is carotid stenosis, which can lead to transient ischemic attacks or ischemic strokes. The study found that combining radical cervical dissection with high-dose radiation improved survival rates and decreased the likelihood of carotid stenosis. When most people think of a treatment team for head and neck cancer patients, they discount speech-language pathologists. However, SLPs play a central role in the screening, assessment, diagnosis, and treatment of these patients. SLPs are able to provide preventative information to clients who are at risk for head and neck cancer, assess speech, language, resonance, voice, cognition, and feeding or swallowing in these patients, and create treatment plans and provide treatment. SLPs treat many of the side effects that head and neck cancer treatment cause, such as difficulty swallowing and impaired speech and mastication. Researchers have been developing new treatments for patients with head and neck cancer. A new treatment method is transoral robotic surgery, also known as TORS. This is when a robot surgically removes cancerous tumors and some surrounding healthy tissue from patients whose cancer is located in hard-to-reach areas of the mouth and throat. The study by Mecciariello and his colleagues had 349 participants that were treated with TORS. They found that TORS was as effective as radiation and had decreased side effects, such as carotid stenosis. After completing the study, they believe that TORS is an effective treatment for patients with head and neck cancer. Thank you for watching.